Hey, thanks everyone who's joined the call. My backdrop is actually real. I'm sitting in Sydney. I have a property in the edge of Sydney as well. I normally live in Auckland, but I took advantage of the travel changes in recent times to see my family. But today it's about Well Revolution and their use of the Alex platform. I've known Frame now for probably come up to 18 plus months, Frame. And Well Revolution, one of the first groups to really, I think, challenge the way that you could start to look at integration with medtech platforms and other partners as we go along. And I'm really looking forward to seeing what Frame and the team's showcasing today. They are looking at different models of care, and as their name suggests, they're trying to evolve and how healthcare models are delivered. So really pleased for Frame and the team to be here today. And we also obviously can take Q&A and questions through either the Q&A or chat. So yeah, feel free if you want to fire a question in and we can see what we can do. But over to you, Frame.
Great, thanks very much. Hi all, I've got a deck which I'll share and just step through. What I want to do is share some of the experiences that we've been through over a number of years and some of the things that we've learned, and share some of the ways that we've been thinking about new ways of delivering care. They're not the answers to the challenges that we're all facing. It's just they're some of the answers that we've come up with in partnership with the primary care practices that we currently partner with. So screen share is enabled, yeah? Good stuff. Thumbs up if you can see that. Digital primary care, cool. So kicking off, start by recognizing the fact that primary care has just lived through a very rough time. And importantly, most primary care practices have made it through and survived, some with ease and others with a lot of pain. But one of the key things, obviously, and we're all aware of this, is demand for primary care is growing. But there's a lot of hard constraints on the workload of primary care providers, and we need ways of balancing that equation. It's if something's not working or not working well enough, we need to find new ways of working. And new ways to more than just survive, but thrive. And that's what I want to touch on today. Now, going digital, when we say going digital in broad terms, that could be taking your business online, it could be doing things that involve digital technologies, whatever it might be. Going digital is no longer just an option. To go digital effectively, new tools are needed. And one of the other problems we see is that, of course, new capacity is needed in primary care, because this capacity is not going to grow on its own. But where is this capacity going to come from? Consumer expectations have also changed a lot, but have ours. And many things are affecting our workforce. What we see in particular in the work that we're doing is that younger doctors are becoming less interested in practice ownership. They're wanting more flexibility in the work hours. Many people, and us included, found out through necessity that working from home is possible, but is working from home possible for general practice? And from our experience, we're learning that yes, it is, but achieving that needs a digital first approach to work. And I touched on it before, is that this goal that we're working towards is trying to increase the capacity of primary care. A new digital care market is forming, and it's only going to grow as the shift to digital gains momentum. And as more consumers engage with health services more often, we're going to see increased interactions from services being more accessible, more convenient, and more timely. And these increased interactions, they can really only come from increasing capacity. And that increased capacity can really only come from building more infrastructure, training and hiring more clinical staff, or by practicing more efficiently and increasing the capacity of each and every provider. And there are many ways that that could be done, but one way of doing that is to move more interactions online, automating as much as possible, and providing new ways for clinical staff to work. So it's not a new concept, but it's very, very hard to do. And it's absolutely necessary if you want to be able to thrive into the future. So I'll leave this up here for a bit and just sort of talk you through some of the thinking. It's over the past 2 years, a lot of questions have been asked and pondered with our practice partners. And more recently, when we have moments to think beyond our immediate pressures of packed work days and fighting fires, this is a question that we think about a lot. And when we think about this question, we may be drawn to thinking about what we're noticing or starting to notice. We might be thinking about a new generation of online doctor apps and tech-enabled clinics that are entering the market and aggressively competing for customers. We might think about or believe that that competition is only just starting and that many more are likely to come. We might also believe that this competition is not yet affecting us. We may be thinking about how difficult it is to retain, attract, and hire staff. And the Great Resignation is very real, and many are feeling its effects. Practice staff might be overworked, they might be overwhelmed, unmotivated, and that could be leading to high churn. We might be thinking about the cost of infrastructure rising under the pressure of inflation, and how this erodes profitability with more funding, without and sort of lack of extra funding coming or being able to increase co-payments. You might want to do something about it, but what do you do? Where do you start? Do you just watch the change happen around you? Or do you do something to protect your business and the livelihoods of yourself and your staff? This particular question is something that we use because we think it's very important to try to think ahead, to try to imagine what our business might look like in a few years' time. And from that imagined future, then look back to remember what we did to get there. Digitizing your business should start with the goal of becoming digital first. Now, that future you imagine should be digital first. And it can mean a lot of different things to different people. I'll talk about what it means to us and to the practices that we work with, their providers and their patients. One thing driving digital first is how we think about what the future of work will be, or what we think it's going to be, and what parts of that future could be achieved right now, today. We absolutely believe that clinics will need to adopt a digital first approach to be able to maintain the flexibility, inclusivity, and the connection that they're going to need with staff and patients to be successful. Now, digital first means to us encouraging people to work and engage when and where it's best for them. What it doesn't mean is just taking the old ways of getting care, which is rigid 9-to-5 work days packed with countless 15-minute appointments, and then trying to recreate those online or trying to recreate an online version of that. In the 8 years that I've been involved in online primary care, and more recently in the past 4 years since co-founding Well Revolution, I've seen a lot of experiments in delivering primary care online. And I can summarize 8 years of learning into this. Not everything in general practice needs to be an appointment, in person, or a phone call or video call. to take a digital-first approach, you must be able to support all ways of working and getting care. And that's synchronous, like face-to-face, even a phone call, or asynchronous, like messaging, email, written documents, pre-recorded audio-visual content. And care can be provided in person, it can be provided remotely. It can be structured and it can be informal. It can be scheduled, it can be unscheduled. This is a number we believe in. And from our collective past experience and the experience of the providers we work with, this is the percentage of care we believe can be provided remotely outside of the clinic. It can be a controversial number. It might be unbelievable. Others have claimed to have achieved it. Irrespective of what we might believe, it's a target. Even if the probability was only being half right, that would still be a large portion of care delivered remotely. Now, imagine if you achieve delivering 40 to 80% of the care you provide now remotely and online. What might that mean for your practice, your staff, your patients? It would certainly mean that you'd have magically created additional capacity inside your practice. And what would you do with that gain in capacity? There'd certainly be more capacity to provide services to more people. You could expect the cost of delivering a service to decline, meaning that you're now able to provide service at a lower price point and or grow profitable margin on the services that you provide. You could expect to see more staff working outside of the clinic, with GPs and other clinical staff working flexible hours from home or from wherever they want to be. And when you're providing convenient and timely access to your patients, who are now, by the way, receiving service from happier providers, you could expect to see more interactions. And if you have the flexibility to bill for those interactions, you could expect to see growth and more profitable revenue. Just as an example, while Revolution is a brand name known in New Zealand today for delivering primary care from an app, we were the first to do so. This isn't actually our business. We started with an idea of providing a product that primary care practices could use themselves to service their own patients. A pandemic got in the way. We launched a consumer business to prove what was possible with the clinic partners that we were working with. And through this, we ended up setting the benchmark for the price of a consult online in New Zealand. This is a price that we provided for the last 2 years, 7 days a week, including weekends, nationwide. And we provide this price, which is lower than the national co-payment average, with profitable margin and zero public funding, subsidies, GMS, clawbacks against general practice, nothing, completely private. This is really just to demonstrate that with the right people and the right tools, anything is possible. Patient portals have been a great step forward for general practice, the most widely used way to interact with practices today. And they've done a great job, but they really only buy you into the game and get you part of the way to where you need to be. They're really the bare minimum you needed to do 5 years ago. More is needed to help you thrive into the future. And I'm going to show you through some of the ways our software is being used in general practice today. So, big difference with what we do is that doctors and patients are both in the app communicating. So you've got no appointment chat consults and in-person appointments at the touch of a button. The chat consults have been designed to provide much greater context, with the use of photos and voice and video messages inside the chats, and the ability to sync up when you need to. and go live with audio and video calls, whenever that's needed. People can view and email themselves their lab results, and it's all designed to fit flexibly around a person's life and schedule. Very few actions are needed to get a job done. Every interaction is billable at the discretion of the practice, and payments are made seamlessly and automatically. Patients are also given agency to decide when and where to fill their prescriptions, which helps to reduce errors and saves practice time. For the providers, they're able to give patients service directly inside the app. So, like chat consults and approving repeat prescriptions, which means that they could be anywhere. Literally, they could be out walking their dog in the park, and we have doctors who do that. We provide task bots to automate a lot of what were manual and paper-based processes, like writing a prescription or writing a medical certificate and billing for consultations. And via Medtech's Alex API platform, the patient's medical record is integrated into those interactions. We also make it really easy for care and work to be collaborative. So secure staff communication is built into the app, and through private chat groups, they can chat, share information, ask questions of each other. Saves a lot of time on emails and phone calls, and improves team collaboration and involvement. All practice staff have direct contact with Well Revolution's product and support team, and we encourage that a lot. It's where they can participate in new feature designs, give feedback, make suggestions, and share ideas. And we also provide direct live in-app support for patients and staff, 7 days a week, which saves practice a lot of time. And our average response time is in minutes, not hours or days. I just want to put up one quick example of a time saving, of how digitizing and automating a process can save time and cost, and also ensures revenue. Now, repeat prescriptions is one common example of a process that can be heavily automated with software. It can be quite common for a practice to provide a lead time of 48 hours for a request. Not all, it varies across practices, but so in general, many practices do have a 48-hour lead time. And in that, lots of hands can be involved. A lot of time can also be wasted. Not that every practice takes all of these steps, but in general, it sort of covers a broad spectrum of the things that generally happen inside a practice to get a prescription handled. And at the end of it, hopefully the patient gets what they need as quickly as possible, and hopefully the provider gets paid for their work. So much of that work and that process can be abstracted away with software and automations, and also by giving patients the agency of choice and responsibility. And by automating the payments, you can also ensure that everything is that should be billed for actually is. And this can reduce the time of processing a repeat from days to minutes. Riordan or Lawrence, I could run through a live demo if you'd like to see it, because I think I've got one of the accounts on the app connected to every practice has a Mickey Mouse. I've got a Mickey Mouse patient at one of the practices using the Medtech Alex API Live, if you wanted to do that. Do we have time?
Yeah, I think we have time, mate. I think that'd be interesting.
Cool. Okay. I'll stop the screen share then, and I will share my phone screen. A second phone here to show the provider as well. Can you see that? Okay. So what a practice patient would do is we've centered everything around this single button of select service. So we'll start with a chat consult. It's one of the first things that we started with when we built the app. So if the patient wants to get service today, they can start an asynchronous chat consultation. confirms the price. They then jump into a chat. So, they can write, they can take a photo. They can also do the same with video messages. They can take a live video message. They can record audio messages if they can't be bothered typing. Or they might use text to speak. And this goes directly to their either preferred provider or the first available provider. And this is just a chat consultation. The doctor can respond in the same way, and the doctor can also do this whenever they're available. So the person's not sitting here, the patient's not sitting here live waiting for an immediate response. If they want to book a clinic appointment through the Alex API, it's pulling up whichever providers are available. I can select that provider who doesn't have an appointment there at the moment. Let's find one who does. Let's go to the doctor. They can then scroll through the dates, find a time that's suitable for them, check the details, confirm the appointment. Because that's a live one, I'll actually cancel it. And repeat prescriptions. So to order a repeat, this through the Alex API pulls through the patient's long-term medications. All the patient needs to do is tap and select the ones that they want. They can make a note. Paracetamol, say. Check that's what they wanted. Remove anything or go back and change it and send it to the doctor. Confirm whatever the practice's pricing is for a repeat prescription, from free to whatever the price might be. And then confirm. And now that prescription is pending approval. They can also say check lab results, and through the Alex API, this is pulling through the lab results that have been released for the patient to be able to see. They tap and they can view. And what we do here is we translate, because they come in different formats, and we translate them all into a image format that's readable on a mobile device. So you're not working with much real estate for them to be able to read and view their lab results. They can also send it directly and email it to themselves at the email address that's registered against their account. So that's just a few of the things that a patient would do. I'll switch over to doctor. A different font. Okay, so here's the doctor. So that doctor, oh, wrong one. That's that chat the doctor was in. So in here they can, chat, which we already went through. When the consult, hi, there's nothing wrong with you. And when they're ready to do something, these are the task bots that I mentioned before. So they can write a prescription, they can close it as a child consult, they can write a sick note, but let's just say do a standard close. I'm going to add a consultation summary. Test. And then the consultation's closed, automatically billed. The doctor can keep messaging, but on the patient side for this practice, they've closed that consultation off. So now the patient would need to start a new consultation. And for the doctors at the clinic or at home or anywhere, the requests for repeats come through. That's that one we just did. Brings up any allergies. And this is using the Alex API, so the patient profile information comes through. They can check the photo identification, personal information, check their medical history, look at their current medications, view their lab results. They can also go through and check all of the patient's activity, that's the consultations and things that have happened inside the app. And they can also write other private notes with providers. And then from here, if the doctor's satisfied, or this may have gone to a nurse review first, but in this case, we know this patient, we may be happy. All we need to do is tap to select, swipe left to decline, tap to approve. This person said they want medication. So let's give them paracetamol. That adds that medication to the prescription. The doctor can write a note if they need to. Then just tap to complete it. Then on the patient side, we swap phones. Patient gets a notification from the bot or the assistant for a receipt for their payment and for their medications. It's the one we just did. They can check the details. I see the doctor's declined that one. But all the patient needs to do is send it to a pharmacy. It automatically geolocates to their home address or to their current location. But let's say we're near home, we want this pharmacy. All we need to do is tap send to pharmacy, confirm that's the one, and the patient's job's done. So that's a few of the things, and that's using the Alex API live right now. I'll just bring up bring back up the deck. So this is just the the first things that we're doing, and some of the examples of what we've implemented in clinic now. But importantly, the platform is being developed continuously with the direct input from our customers and the practice partners, their teams and patients. This here, I just wanted to show you and share with you some of the simple metrics that we use. Co-design is at the heart of all of our product development, and the direct consumer and clinical feedback informs all of the product design work that we do. The practice staff we have direct contact with, they have the ability, obviously, I mentioned before, to share ideas and to participate in this community of colleagues and peers who are all trying to create the kind of primary care that we want for ourselves. And we think that reflects well in the reviews. This metric, how disappointed, is a simple metric that we run to measure sentiment from practice patients. So when they're asked how disappointed they'd feel if their practice no longer provided the service. And those are people who are disappointed in a good way, by the way. And they provide feedback on what worked and what didn't work for them, which is then fed directly back into the product design. Yeah, so we can do a Q&A if that's what you want to do. How much time do we have? Well, that was pretty short.
I think we do have a Q&A session. Hey, well done, Frame. Well done. It actually demonstrates, rather than any organization or software developer thinking they can be everything to everyone, this is fantastic. Well done, Shane. Well done, Frame. I knew you guys had a great vision, and seeing that operate for real with a real environment and the speed, very pleasing from our end, and it clearly demonstrates why we went about trying to build the Alex platform, so that innovation can come to the table. And you guys have done it. Well done.
Absolutely, thank you.
That's my feedback. That's my feedback.
without it, it doesn't work. So it needs everyone in the ecosystem, and and Medtech's a really big part of that. And without that API, none of that would work. Do we have any questions? Thought surely I would have said a couple of controversial things in there that would prompt a question or two.
And I'll ask a question, Frank. How does a practice go from what they've been doing, as you say, in quite trying and difficult times, to look at that change management aspect to it? Because I've seen Sasha do these consultations clearly while she's doing other stuff, and it works quite well. So how does someone, I suppose, adapt to that type of change?
Yeah, so what we do, and with our practice partners, is change is really hard, and it varies between people, right? It's quite scary. You get people who agree, who disagree, and we always try to bring it back to, okay, what does it mean to the patient? What do they want? And have you talked to your patients? Have you asked them what they wanted? In some cases, they've got no sort of framework to think about what they might want. They think about their experiences in other industries, like, the common ones that always use the banking and other things, right? So we start with that. For introducing it into a practice, it has to be steady, careful, methodical, and de-risked. A lot of things that we do is we have a really good group of really good GPs who are digital doctors. And these are doctors who work in clinic, they work at home, they work at their batch, they work wherever they are. We've got one who was working who went to Ireland for a little while, another one who went to somewhere else in Eastern Europe for a little while, and they always come home, but they work as digital doctors. And we normally start by introducing it with those digital doctors into these practices. And they directly work with the practice doctors who are all flat out inside practice, with full appointment books. They don't have any time to do anything else. So they work closely with them to help them, train them. We do a lot of training, and we give them time to sort of experience it, watch the other doctors using it. And no one is better at training on how to do something than the doctors themselves who have been using it for quite a while. Because what they do is they share their experiences. This is how I work. This is how I plan out my workday. This is how I block off time at these parts. And another doctor's saying, what works better for me is I do something this way. Right? And so we let them experience it and use it. And from that, the only way to really understand it is use it. Right? And once they're using it and they're working with peers and colleagues who are using it, and then they see the reactions, and they see the shared 5-star reviews that come through, and they're not really used to hearing good praise from patients. And so there's a number of things like that which help to motivate and encourage and convince. But it has to be done on everyone's own time, not own time, more about on their own time in the way that they learn. Right, so it's really hard. We haven't got all the answers yet, and I'm happy to share. I do share with people who might be considered competitors. Happy to share that, because we're all trying to learn at the same time and same speed.
Have any other questions? There's a question asked about Manage My Health and some other portals. This is actually providing choice and options. Manage My Health is owned by Manage My Health, is no longer part of Medtech. And so what Well Revolution and other partners are doing are building applications that for different occasions, different situations, and that's what this has always been about. So yeah, I encourage people to look at the different things, but very, very, very well put together application that Well Revolution guys have done to see that true end to end. Very, very impressive. And I know you've been doing this for 4 years, Frame, but your work with the Alex API and some of those workflows, it's in the order of months, not necessarily years.
That's right.
The thinking's a lifetime of experience, Frame, but the actual development is in months. So, I really encourage people to have a look at. Very, 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 very well put together. There's some
Is
other
there a
questions
roadmap?
coming in.
Is there a roadmap for Well Revolution as a product? Absolutely, there is. There's not much in the way that we share publicly, but that is very much something that we'll be doing. We share that with our customers and partners, but it's not something I necessarily share right now. But essentially, I could summarize it all into where doing things that are making it easier for our practice partners to do what we do, what we did improved, but under their own brands. It's not about Well Revolution. It's we're building it in a way that they can use it under their own brands.
Can you name some of your partners? I know them. I know some of them.
Yeah,
Can you name some of them?
It's probably not my place to. I'd rather them
Okay.
mention it, because it's
Yep.
a lot of it's been in stealth. I mean, this is really the first time I'm talking publicly about it outside of industry associates.
Yep, that's fair enough.
Is there a summary to show at DHB admission? Is there a summary to show at DHB admission?
I think what they're asking there, I think, Fran, is can you call up the patient summary effectively through this type of application?
Well, we know
You have a
that's
crack at answering
available.
it first, Fran.
That's available
Yeah.
from the LX API, right? So anything that's available in the LX API, we could. It's not specifically a use case we're doing now, but the capability's there, and we have the flexibility to make that something very simple to do.
Now, the interesting thing, just to pick up on that, so because we're using a FHIR IPS standard with the Alex platform, if you walked in with your health summary in your phone, so to speak, and there was a use case where the emergency department might be using the Alex API through a different mechanism, you get the same answer, which is encouraging. And that's probably a key part of why you use standards. So that one API allows multiple use cases to come into play. So if you're an emergency department at the pharmacy, you're an after hours care, or you're using the Well Revolution type application as well, that you can use it, as Fran showed, pulled up the patient record so that the clinician can be making judgments based on that information, even though they're technically using their phone. Now, when those have done those changes or whatever services they might be providing, that obviously can also be pushed back into the PMS. But you're not getting into emergency department scenarios yet, right?
No. But there is, I understand the use case for the patient of a primary care practice who has that functionality available if they happen to be in a hospital. There's trying to think, there's a comment or a question. Understand what you were saying regarding changes is hard. I have 30 plus GPs and none of them want to work out of hours. I'm very firm with normal hours. If did out of hours, this would come with an increased cost to the patient, which is not ideal. Okay, that's a good comment. If there's a question, add to that. There's another question here. Are patients charged when using Well Revolution, or does the practice get charged for patients' usage of the app? So patients pay for a service based on what the practice sets is, if that service is billable or what the price is. So it's completely up to the practice.
Do you discuss your business model, Fran? Because that's obviously a user pays type model. Are there additional fees to the practice above and beyond how all that all works?
Not yet. We hadn't really figured it out. Our focus has been on building the product, and we don't really know what the model is going to be. We've been providing this throughout the pandemic and to date to our practice partner at a flat, low percentage on all the billing. But I would expect, like,
so you're doing a revenue share. Yeah, you're doing a revenue share with the practice.
Wouldn't even call it a revenue share. It's we lose lots of money. what the
You need to
right
scale,
now,
I think, Fred, is what you're saying. You need to scale,
right.
Fred. That's
but it will get to a point where, like most software products, they need to be easy to understand and a simple billing model, and that is a combination of a monthly software fee, and if it's our platform providing the payments, and it doesn't have to be, then there'll be cost of transactions, of course, because there's cost in doing that. But right now, there's no real set business model. I know that doesn't help trying to sell our solution to anyone, but I'm not really trying to sell our solution to anyone just yet.
How do people get hold of you, Fran?
Go to well.as. WELL.as, which goes to our website and has the contact details. And do you mean get hold of me personally?
Oh, no, just I want to find out some more.
Sure. I mean, you can email me personally too at f@well.as or frame@well.as.
Really like a short email, Frank.
I've got really good spam filters. It is very short. So do we want to give people a bit of extra time back in their day? I love it.
I think so. Short. Is there any more questions? Hey, thanks again, Fran, for showing that. As I said, I met Fran and Sasha well over 18 months ago, and they had a vision of offering different models of care, and I never had doubt. Never doubted, Fran. Never doubted.
No, it was more than 18 months. Don't forget. I always struggle with, I said this to one of our team meetings this morning, I struggle with the difference between 6 months and 6 years right now. But it was definitely more than 2 years, because we've been in a pandemic for 2 years, and we met you pre-pandemic.
Oh, okay. That is true. That's true. That was pre-Medtech. That was pre-Medtech.
I even remember the place where we met and had a good discussion.
I think we're getting into small talk now, Craig. So I don't think the audience wants to hear you and me talk about coffees and something. So, hey, I'm going to wrap this up. Hey, thank you so much for all who joined. These videos, if you want to share it with friends and colleagues, and I will be available through the Medtech Insight portal, I believe, or we can help you find a link if that's an issue as well. So, thanks again, Fran, for the time, and thanks again for everyone who joined.
Great. Thank you, Jeff. Thank you, Medtech.